What are the benefits of taking kids in for adjustments?
Yes. So I'll answer that straight, and then there's discussion about this.
Okay.
I don't want
yeah.
to take too much time
Yeah.
on all of this stuff, but this has been a fascinating thing to me because the thing that really fired me up about chiropractic once I was in chiropractic school and actually understood the full scope of what chiropractic can offer, the thing that really fired me up was this idea that, oh my goodness, if we have a healthy spine and nervous system that gives our body the best ability to be as healthy as possible, every child on the planet needs to have that opportunity.
Mm-hmm.
Like, that's what fired me up to do my pediatric training. And that's the foundation of what's the benefit of a kid going to a chiropractor, is that our children live in this unnaturally stressful environment also, with parents who are stressed out by this unnaturally stressful environment.
Right.
And so the things we eat, the things we drink, the things that we do with our bodies, you know, the fact that we all, even as children, are looking at these little things like this all day long with our devices and that sort of thing. So, like, why is it good for a kid? Well, it's good for a kid because the kid's body has to be functioning as best as possible if what we want for the child is optimal growth and development.
I see.
And that again, that leads right into this whole concept of, like, or maybe this whole story of how what we've experienced with our now 8-year-old.
Yeah.
Which, again, if we want to talk more in depth about that.
Well, if you want to share that story.
Yeah. Well, I in my talks, I oftentimes ask the question, like, when's the best time to work towards health? And, you know, everybody, you know, people, oh, well, right now.
Right.
It's like, yeah, well, the Japanese proverb asks, when's the best time to plant a tree, is 20 years ago, right? When's the next best time? Right now, because it's the only time you have. So when's the best time to work towards health? Preconception. When's the next best time? Right now.
I see.
And so, fortunately, I mean, Christina and I had Will when we were 5 years into practice. Yeah, 5 years into practice. And so we had built this philosophy, and we had talked about this, and we had taught this philosophy for quite some time. And so I said, I mean, we had this conversation, like, if we're going to think about bringing a child into the world, we have to absolutely follow this idea of that starts preconception. And so we did. We both worked on our own health as much as possible to optimize what we were doing. Had a great pregnancy, and we now have an 8-year-old who has never had a drug, has never had a shot, has never had a, trip to the doctor's office for reactive purposes, and who's spent, I think the count now is 4 days on the couch not feeling well in 8 years. And just the other day,
it's amazing. Does that include, like, colds?
Yeah.
And stuff? Oh, wow.
Yeah. So, he'll have sniffles and stuff from time to time. And I just had, like, 2-3 weeks ago, I'm glad we're doing this podcast now, because, like, 2 weeks ago I wouldn't have been able to talk to you, because I did have this cold. And, like, 3 or 4 days into my cold, we're sitting at the breakfast table, and he was kind of sniffly, and I could tell his eyes weren't quite as bright as they usually are. And he goes, "Dad, do I have a cold?"
At 8.
At 8.
That's amazing.
And I'm like, yeah, this is kind of what people would call a cold. It's not too bad. Like, the next day he was just fine. And it's not all about not having sickness,
Right.
But most people don't have that experience with their kids. They're kind of running them to the doctor frequently, and they are stressed out about the symptoms that they are expressing. But the flip side of it, the growth and development side, is he's hit every growth milestone. He's hitting all his developmental stuff. He's just, obviously I'm biased, but he's just sharp as a tack, and, just really great interacting with adults. And, there's just, like, from every aspect, I can look back at it. And that's why I say, yeah, the $500,000 it cost me to become a chiropractor, I would absolutely spend again only to be able to take care of my own kid.